And in this instance particularly, if you don't see an immediate improvement of at least 50% or more in your tennis elbow symptoms, we need to keep tweaking the taping technique that we've used until you find that extra benefit. G'day and welcome back to the channel. So in today's video, I want to show you the taping technique that I use for my tennis elbow or lateral epicondylitis patients. Now the important thing about this taping technique is that it's very specialized and can be tailored specifically to you and your symptoms. And because of that, I feel like it has a little bit of an advantage over the general over-the-counter braces or straps that you might get for tennis elbow. But it's always really important to understand that taping will only ever be a short-term solution or a short-term help to any issue that you may come across. So not only is it really important that you feel comfortable that you can rely on a taping technique to help you manage your symptoms when you just need to get things done, but we also need to make sure we're having that broader conversation about why those symptoms are there in the first place. And by having this conversation, we can start to figure out exactly what you need to change while you're taping your tennis elbow to make sure that you can get to a point where you don't have to keep taping it anymore. So the other thing I want to go through in the second half of this video is I want to touch on what I'm finding clinically to be the potential hidden underlying cause of tennis elbow that I don't think many people are understanding or finding at the moment. So before we get to this information, if you're going to enjoy this video, please consider leaving a like rating down below. Let me know in the comments down below how your tennis elbow is going. How long have you had it for? What have you tried that works, that doesn't work? And if you do find it helpful, if you find this video genuinely insightful and useful for you, please consider leaving a super thanks donation on the video. It's just a great way to help support the channel and keep me being able to produce this type of content going forwards. So before we even get to this taping technique, we need to cover two important topics that really help give context to what we're doing and why we're doing it. The first thing, which I've already covered briefly at the start of the video, is that you need to make sure that you're very comfortable with the idea that taping will only ever be a short-term fix or a short-term help. It will never change or fix your problem. The idea behind taping is to give you support so that you can do things that you need to do day to day, whether that's work-related things or even sport-related things or activity-related things, if those things are important enough to you in the face of extra pain and more discomfort. So the concept that we need to make very clear with any taping technique is that it will not fix anything. So you need to make sure that you're understanding why that issue is there in the first place and working on a treatment plan or a series of exercises to fill the gaps that you might be missing, perhaps taking care of the things that have caused that tennis elbow if we had to get you to the point where you don't have to tape anymore. Now the second thing, which I think is really important to touch on before any taping takes place, is that it's really important to take a baseline measurement of your tennis elbow symptoms before you tape, so that when we do the taping technique, we can compare change afterwards. And it also gives us the luxury where if things aren't as good as you need them to be post-taping, you can then modify and subtly tweak the taping technique itself to figure out what you need to get yourself to an acceptable level post-treatment and post-taping. And in this instance particularly, if you don't see an immediate improvement of at least 50% or more in your tennis elbow symptoms, we need to keep tweaking the taping technique that we've used until you find that extra benefit. So in terms of the taping technique itself, we obviously want to focus on the area where the tendon, the forearm tendon, attaches into the side of the elbow, that lateral epicondyle. The tape will just hopefully help normalize that to some degree so that your symptoms aren't stopping you from doing what you need to do. What I like to do is I like to take some sports tape. So this is rigid Leukoderm sports tape. And the way that I like to start doing this is I like to take a bit of a strip out and then just wrap it around so I know exactly how much tape I need to use. We want to rip off a piece of tape. Now this is quite thick for what we want. We probably want half of this. If you have the thicker tape as well, it probably ends up being a third of this. So what I'm going to do is I'm going to tear it straight down the middle, and I'm going to place this piece of tape around my elbow or just above my forearm at the base of the elbow. Now, if you are someone who has sensitive skin, please use the coverall or the Fix-A-Mol white tape. It's the stretchy porous tape that you have to take the back off of. That is generally more hypoallergenic. It's generally a lot nicer on your skin. If you put this tape straight on your skin for any length of time, depending on how sensitive your skin is to the glue, it can irritate your skin. So if you're someone who needs to consistently keep taping day after day after day, please consider what type of tape you use here to make sure that you're not getting a reaction, because at some stage you'll have to take a break to give your skin a break, let it heal, let it recover. Now again, once you've found the area that feels tender, just above that is generally where we want to aim for the tape. So what I'll get you to do here is we'll just get you to place the first bit of tape over that specific area. And what I like to do with this is I like to generally create a little bit of a pinch in the skin just over where the symptoms tend to be, so that when I bring the tape over, it gives a little bit more pressure and a little bit more tension in that area. Now, the one thing we want to avoid with this taping, as I said, is we don't want to create a tourniquet all the way around. So when the tape goes around your elbow, please don't meet it in the middle or overlap that tape. The best thing to do is to have the tape split off in a different direction, just so that we're not creating any unnecessary restricted blood flow. And once you've done that first bit of tape, you might see that the skin sort of folds up a little bit there. This is a baseline piece of tape. So when you do your test and retest again, you'll see that it may not make a huge difference straight away. But the benefit of tape is that we can keep layering on new pieces of tape over the area until we find the ideal scenario to decrease your symptoms. So same thing again, place the tape on there again. I want to make sure that I put a little bit of pressure over the top, pinch the skin a fraction, so that when I come over the top here, I can see a tiny little bit more of a crease, and then pull that around with as much tension as you feel comfortable. So again, we don't want any pins and needles, we don't want any numbness, we don't want any tenderness or hand symptoms going on. If you do, clearly the tape's too tight. You should also feel like you can bend and straighten your elbow. We want to make sure that it's very, very comfortable, while at the same time putting a little bit of pressure through that area. Now, again, please check and recheck your movements to make sure that you feel like that little strip of tape with the pinched bit of skin underneath is sufficiently decreasing your symptoms enough. Now, I've made sure that the tape goes down through here. You can certainly make the tape come up a little bit higher if you're trying to get a little bit more pressure up onto the junction between that lateral epicondyle and the tendon, the forearm tendon. But that is a nice way to begin the conversation for you. Now, obviously, it is a little bit awkward if you do it yourself, but having a second set of hands to do that is much more efficient and generally much more effective. But as you can hopefully see, you can do it yourself. It's not impossible. It just takes a little bit of practice to make sure that you feel like you get enough tension on the right spots to improve how your symptoms feel. Once you feel comfortable that you've nailed the taping and it makes you feel better, we now have to have a conversation about what's causing that elbow to become irritated in the first place. So for me, clinically, what I'm finding is that there's a section at the base of your neck that has the nerves that relate to your elbow, and the radial nerve in particular that goes down through this very area, that when dysfunctional in terms of stiffness, tightness, restriction, then it can create this chain reaction of events that can cause some havoc with anything that associates with that area. So we have the radial nerve that comes down here. So if your neck is a bit stiff, it can create some extra neural tension, which can set this area up for failure. When you add in the repetitious cycles of hitting a tennis ball or using a mouse and those sorts of things. So what I want to do in this section of the video is I want to show you how to figure this out for yourself, so that you can take the original baseline testing that you did, whether it's grip strength, whether it's strength testing, whatever it is, do that first, treat your own neck dysfunction, retest those same tests and see that there's potentially a link there. So what I want you to do is to take a tennis ball or a lacrosse ball, lie down, and let the ball gently press into your neck. Now, what we want to do here is we're not rolling around. Again, we don't think that works as well as constant pressure through the specifically restricted joints. And what I want to get you to do here is, when you've been on the bump and just rolled immediately off to the side a little bit, we're on the joints, we're looking for how stiff, tight, and restricted they might feel. Now, compare that to the other side and take note of which side you feel sinks in easier, which side feels more restricted, which side feels softer. Irrespective of which side your tennis elbow is on, we want to be on the side that feels the most restricted. So if you have a restriction on one side, that restriction can mechanically affect everything above it, everything below it, potentially everything in front of it or behind it, depending on where it is, and things either side. So if we're not taking off that central handbrake, then we're potentially missing the potential root underlying hidden cause of all of this dysfunction. Even though it's all the way down here, it can connect potentially back to your neck and on the other side. So that being said, once you've found the segment that you feel is a little bit stiff, Literally just let the ball press in for 30 seconds, a minute, 2 minutes, whatever you feel comfortable with. Then once you've done that, move the ball down a fraction to the top of your thoracic spine. Work down as low as you feel you need to in terms of anything that feels stiff or tight, and then work your way back up again as high as you feel you need to, and try and capture anything that you feel is restricted that shouldn't be restricted. Mobilizing those stiff segments, we can then recheck your baseline measurements, again, whether it's grip strength, whether it's resisting you or twisting you, whatever it might be, whatever gives you your symptoms previously, we can then take a very strong reading of how that feels after mobilizing your neck. And remember, you don't have to have any neck pain to have a dysfunctional neck. If your neck doesn't hurt, all that means is that your neck isn't painful. It doesn't mean that it's functioning normally, and you can't tell whether a neck is functioning normally until you individually assess each segment and each joint of the neck, the muscles around the neck, and the strength of the muscles in those areas to get a really strong sense of how everything is put together. So I strongly urge you that if you've come here for the taping technique, please take time to assess your neck and see how much, if anything at all, is connecting to your tennis elbow symptoms. Fit that into the traditional tennis elbow rehab program in terms of eccentric strengthening and massage and stretches and all these sorts of other things that we can get you to do to try and get on top of those symptoms. And I'm hopeful that you'll find, much like my patients do, that a little bit of tape and a little bit of work on that neck can be a really powerful weapon against tennis elbow and getting that to improve going down the track. So I genuinely hope that was helpful and insightful. But with that being said, thanks for watching, and I'll see you next time.